Congratulations on taking an important step in addressing the key physiological component of your panic symptoms. Freespira is an FDA-cleared treatment for panic symptoms, including panic attacks. In clinical studies, most patients were panic attack-free immediately post-treatment, and nearly 80% were panic attack-free 1 year later. We all breathe in air and breathe out carbon dioxide, also called CO2. Many individuals with panic attacks chronically hyperventilate, also known as overbreathing. They breathe faster and often deeper than normal, leading to irregular breathing patterns and a lower than normal exhaled CO2 level. The goal of Freespira is to train you to normalize your exhaled carbon dioxide level and stabilize your respiratory rate. By doing this, most patients will experience significant improvement in their panic symptoms. It is important to follow the recommended twice-daily sessions for 4 weeks. Try to space 6 hours between each session. Ideally, do 1 session in the morning and 1 in the evening in a quiet place without distractions. This video provides an overview of Freespira and includes some helpful treatment tips. These are the items included with Freespira: a Freespira sensor with charger and charging cable, a tablet with the Freespira app installed, charger and charging cable, 5 cartridges for sensor preparation, 2 nasal cannulas with instructions for use. Only 1 cannula is needed for treatment, but an extra is provided if needed. A printed quick start guide, and a user manual for reference available on the tablet home screen. The Freespira sensor and tablet will arrive charged. At the end of your last treatment session of the day, it is best to charge the sensor and the tablet overnight. To charge the sensor, connect the white charger cable to the white charger. Plug the charger cable into the sensor and plug the charger into the wall. To charge the tablet, connect the dark-colored charging cable to the dark-colored charger. Plug the charger cable into the tablet and plug the charger into the wall. The Freespira tablet contains a brief questionnaire to assist with assessing your panic symptoms. By taking the brief panic questionnaire, your authorizing clinician will have a better understanding of the progress of your Freespira treatment. You will be prompted to take the questionnaire once a week. This section will walk you through how to begin your Freespira session. Remember to sit in a quiet area and do not multitask. Take the time to focus on your treatment sessions. Remove 1 cartridge, 1 cannula, the tablet, and sensor from the packaging. Power on the tablet by pressing the power button. Remove the tape seal from a cartridge and push the cartridge firmly into the sensor until you hear a click. Turn on the sensor by pressing and releasing the power button. On the tablet, select the blue circle icon. Then select the round gray and orange Freespira icon. Unlock the tablet by swiping the lock symbol up. Once unlocked, the tablet will open to a home screen. The icons are Freespira app, video. This is the video you are viewing now. Guide, which is the quick start guide. Manual, which refers to the user manual. And settings. Select the Freespira app. The Freespira sensor and the app communicate using Bluetooth and will connect automatically when you start the app. Before starting your first session and at the beginning of each week, you will need to prepare the sensor. This will take approximately 5 minutes. Touch the Next button in the app and follow the instructions. While the sensor is preparing, remove the cannula from its bag and firmly attach it to the cannula connection port. The cannula may remain plugged in even when not using the sensor. Once the sensor preparation is complete, you will be prompted to put on the cannula. To place the cannula, Insert the 2 small protruding tubes into your nostrils and wrap the rest of the tubing around each ear. You may need to extend the cannula length and can do so by pulling down on the separator clip, which holds the cannula together. The cannula samples your exhaled air. There's nothing being delivered from the cannula into your nose. Once the app detects breaths, you will be prompted to press Start to begin the session. Remember, you will be prompted and reminded what your goals are when you begin each session. The weekly target respiration rate tones start at 13 breaths per minute. Each of the following weeks, you will adjust the target respiration rate tones to 11, 9, and 6 breaths per minute. You do not need to master breathing at each target respiration rate before moving to the next slower rate. Each 17-minute session is separated into 3 stages: baseline, pacing, and transition. The first 2 minutes is the baseline stage. You close your eyes, sit quietly, and breathe without any tones. You will not receive any feedback during this stage. The next 10 minutes is called the pacing stage. During this stage, you will hear the tones at the set respiration rate. You breathe in with the tone as it rises and exhale as the tone descends. Your respiration rate is shown as a green line on the lower part of the chart. The normal range for CO2 is 37 to 42 millimeters of mercury, as seen in the blue band. Your breath-to-breath CO2 is shown by the blue line at the upper part of the chart. If your CO2 is below 40 and you are breathing along with the tones, it means that you are taking in too much air with each breath. Try reducing the volume of air you are inhaling through your nose, and you will see your CO2 increase. If you would like, you can switch between a graph and the numbers on the screen. Your session will conclude with a transition stage. During these last 5 minutes, the goal is to continue to breathe at the same respiration rate and CO2 level as the pacing stage, but with only the visual feedback and without tones to guide you. You are practicing what you have just learned. At the end of your 17-minute session, remove the cannula. The Freespira app will allow you to review your current session or exit the app. Please note that when you complete a session, it will automatically upload to a secure server. Here are a few tips and techniques to help you get the most from your Freespira sessions. Week 1 can be challenging as you begin to retrain your breathing. There are 2 parts of your breathing pattern that you will be working to coordinate: breathing with the tones at the set respiration rate and moving your exhaled CO2 level toward the targeted range. If it is too challenging to adjust your CO2 levels to meet the target of 40, try focusing only on breathing with the tones for a few sessions. Then try again to move your CO2 toward 40. If your CO2 is below 40 and you are breathing along with the tones, it means that you are taking in too much air with each breath. Here are a few things you can try. First, be sure you're breathing through your nose, not your mouth. Breathe in less air. You should barely hear yourself inhaling. It may be helpful to place your hand on your belly and feel your belly just barely rise and fall with each breath. You may experience mild dizziness, lightheadedness, or some shortness of breath during the first few sessions. If you are uncomfortable, stop the session and these feelings will resolve. Stay positive and keep doing your sessions. They will get easier, and you will see your progress over time. At the end of 4 weeks, the system must be returned to your provider or directly to Palo Alto Health Sciences using the original packaging. Dispose of any used cannulas. Do not return used cannulas. Place the chargers and cables unused cannula, sensor, tablet, and the 5 cartridges back into the packaging and return to your provider or Palo Alto Health Sciences using the return shipping label. Thank you for choosing Freespira. Remember that changing your breathing patterns can be challenging. You are learning a new skill that takes some time to master. Progress toward healthy breathing leads to benefits in reducing panic symptoms and panic attacks.